The effects the Affordable Care Act will have on healthcare access, cost, and quality. Presented by Group 7, Latoya Davis, Elizabeth Lashbrooks, Nancy Mortstein, and Jeremiah Boker. Despite being passed in 2010, the debate over the Affordable Care Act, or ACA, is still very active. To determine whether the ACA is a good or bad law, we must look at major factors it has had an effect on. These factors include who has gained medical coverage since the implementation and how it was possible, the exchanges and how individual states are handling them, the changes to Medicaid, the changes to health insurance premiums, and the political issues on both state and federal levels. What is the ACA? The ACA is made of two separate acts, the Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Act of 2010. Combined, these two acts increase the numbers of citizens with medical health insurance and makes positive changes to Medicaid and the Children's Health Insurance Program, or CHIP. The ACA's main objectives are to increase healthcare access, increase healthcare quality, and reduce medical costs. Who are the newly covered? Since being made law in 2010, 28.2 million people have benefited from its provisions. Of that, 11.7 million people have purchased insurance policies through the exchanges, 10.8 million people have gained medical coverage through the expansion of Medicaid and CHIP, 5.7 million people under the age of 26 were able to maintain insurance coverage by being allowed to stay on their parents' policies, and many more were able to obtain employer-sponsored health plans. The largest group of the newly covered are in their 30s and are in good health, but the expansion allowed by the Act has also reached people who have often been uninsured, coming from poor backgrounds and having less education. The Act also helped those who were previously uninsurable due to pre-existing conditions by making it illegal to use that reason or acquired conditions to deny a policy. How is this new coverage possible? The increase in citizens carrying medical insurance was achieved by creating individual and employer mandates. The individual mandates require all citizens to have health insurance or pay a penalty for not having it, while the employer mandate requires employers with 50 to 199 full-time employees to either provide health insurance for the employees or pay a penalty per employee, and employers with more than 200 full-time employees must provide the medical health insurance and cannot opt to pay the penalty instead. It was also possible with the expansion of Medicaid, which was done by changing eligibility requirements, specifically the maximum income levels. In 2014, the income limit for Medicaid eligibility increased to include those with an income of up to 133% of the national poverty level. Introducing new federal subsidies has contributed to the increase in enrollment of health care coverage as well. Federal and state governments have been providing subsidies through the tax system for health insurance for some time now. Mainly the subsidies were offered to those covered with employer-sponsored plans, but self-employed workers with high medical expenses also received them. The ACA now allows tax credits or subsidies to benefit low and moderate income families. These subsidies decrease the premiums families would have to pay to maintain medical insurance coverage, even those purchased through the exchanges created by the ACA. What are the exchanges? The ACA states that the expansion of healthcare coverage should occur by introducing state-level insurance exchanges. However, that requirement was declared illegal by the Supreme Court on June 28, 2012. Healthcare exchanges are non-profit groups or government agencies that operate and manage a private market for purchasing medical insurance. These exchanges provide small businesses and individuals a selection of certified health plans that meet the requirements of the new law. The state exchanges offer those seeking health plans 4 levels of coverage, which require different percentages of medical costs to be paid by the insured. The level provided The levels provided are the Bronze Plan, which pays 60% of healthcare costs, the Silver Plan, which pays 70%, the Gold Plan that pays 80%, and the Platinum Plan, which pays 90%, all minus deductibles and co-payments. Comparatively, insurance provided through employment usually covers 85%, which falls between the Gold and Platinum plans offered in the exchanges. How are the states approaching them? The success of the ACA is greatly dependent on how the individual states respond to the changes, which has been a challenge since the states have a history of pushing back, as seen in the multiple Supreme Court cases filed by the states. Politics has played a large part in how the individual states have responded to the exchanges. States that are led by Republicans fear the exchange and the ACA in general, so they have refused to establish the exchanges, while states led by Democrats allow the federal government to maintain and operate their exchanges. Since 2013, all states have had an exchange, but who operates and manages the exchange varies. 17 states have state-run exchanges. 7 states have a state and federal partnership to operate the exchanges, and 27 states have federally ran exchanges. There are 51 state exchanges because Utah has both a state-ran and federal-ran exchange. How is Medicaid associated with the ACA? Since the ACA was enacted, the Medicaid program has undergone significant changes. One provision of the ACA is that the Medicaid income eligibility requirement be widened so that more citizens would qualify. The way Medicaid reimburses medical facilities and physicians has also changed by becoming value-based. Previously, the reimbursement rate has been based on fee per service or volume rather than the value of care given. The ACA also includes an information technology systems and data provision, which provides technical resources to ensure the Medicaid systems remain functional. Effects on health insurance premiums. The premiums of policies purchased through the exchanges varies based on several factors, as do insurance policies purchased through other avenues. For example, in the exchange, a 27-year-old would pay $95, while a 50-year-old would pay $936 for the same plan level. However, the cost won't vary based on the health status or gender of the person. All plans available for purchase through the exchange have lower premiums than plans purchased by employers, by an average of 1 to 17%, depending on the plan level. For example, an average age employee would pay a premium of $6,119 with an employer-sponsored plan, while the same person would have a premium between $3,804 and $6,058 if the plan was purchased through the exchange. The change in premium for policies purchased outside the exchange as a result of the ACA is dependent on the state where the policy is held. As a national trend, in states that have expanded Medicaid, there will be more policies issued, so all premiums will decrease, including those purchased through the exchanges. In states that have not expanded Medicaid, there will be fewer policies issued, causing all premiums to increase. The Congressional Budget Office estimates 3 million people who would be eligible for Medicaid with the expansion and are considered to have low income will be required to purchase the policies without receiving any subsidies due to the state's refusal to expand Medicaid. Political issues and implementation challenges. The ACA is a strongly debated topic, especially in the American government on both federal and state levels. The support towards the law is greatly divided among political parties. Currently, 76% of Democrats favor the law, while only 25% of Republicans and 42% of independents do. Despite the federal government offering to pay the cost of the Medicaid expansion, only half of the states have expanded their Medicaid program. Concerns over political sustainability and minimizing expenditures has also contributed to the delay in implementing the law. Political issues and its variables. The financial factor is a large issue in the debate over the ACA. Part of the reason only half the states have expanded their Medicaid program is out of fear that the high national debt would prevent the government from following through on its promise to cover the cost of the expansion. The federal subsidies for private health insurance cost the government about $250 billion in lost tax revenue in 2013, and the new tax credits, which would be in addition to the private health insurance subsidies, is estimated to rise from $45 billion in 2014 to $146 billion in 2017, as more people enroll in coverage offered through the ACA. But many people receiving health care coverage through their employers have already been receiving subsidies for medical insurance through the federal and state tax exclusions. However, most of these employees are unaware of this fact. Those who disagree with the ACA worry that medical expenditures may increase if new drugs are formulated and customers start moving towards the anticipated genetic testing for personalized service. They also fear that hospitals and physicians will join together and expand their market power by making deals with insurers. But the ACA has decreased medical expenditures since the rate of those previously uninsured seeking care for preventative services has greatly increased. This increase is supportive of the ACA because failing to receive preventative care increases the chances of having worsened conditions, which are more difficult to treat and expensive as well. Hospitals and medical facilities also appreciate the new coverage the ACA offers because even if they are reimbursed at lower rates, they receive something to compensate their cost. Those against the ACA also fear that the quality of service will decrease as Medicaid reimbursement rate decreases and private insurance reimbursement rates remain high, and with the increased amount of care needed due to the aging population and newly insured. But to ensure the quality of health care received from the United States health system remains level or increased, the ACA will use the Value-Based Purchasing Reimbursement Method, or VBP, to replace current methods of reimbursement facilities that focuses on volume and services rather than the value of the care given. Higher reimbursement rates will be paid to facilities and physicians who produce better patient outcomes, which ensures quality, and uses better clinical practices, which reduces cost. Is the ACA a good or bad law? President Obama created a frame of what the reform should include, such as increasing eligibility for Medicaid coverage, requiring employers to offer and individuals to have insurance coverage, as well as adjusting Medicare payments and introducing incentives to provide better health care delivery. But had Congress create the plan which allowed insight from state plans such as Massachusetts' plan, which is strikingly similar to Obamacare. This resulted in a drawn-out, controversial, and complicated law. The Supreme Court's decision to allow states to choose not to expand Medicaid eligibility greatly hurts the ACA's success overall because states refusing to do so causes the increase in premiums, a financial burden to those who do not qualify for federal subsidies but would qualify with the expansion, as well as to hospitals and other medical facilities who must treat these patients, and encourages private health care plans to leave Medicare and Medicaid programs, while on the other hand, the increased coverage allows for more people to access medical care while reducing the worry of losing coverage, not being able to find reasonably priced health care, or not receiving quality care. The results of a law will never be perfect. It will always have both positive and negative factors. Society as a whole will benefit because the ACA takes care of those who are unable to do so without federal assistance, such as those under the age of 26 with pre-existing conditions. This is crucial since 45,000 people die annually due to the lack of health insurance. But the economy will hurt by decreasing the national income by more than $146 billion to provide the federal assistance. Regardless of how this law seems now, since the ACA will not fully be in effect until 2012, it is not possible to determine the success of the law overall at this time. The ACA is a very complex law that, while may have been based on good intentions for society, has created a large divide within the country. To determine whether the law is a good or bad law, the complicated task of weighing the positive and negative effects the changes have had on many factors associated with the healthcare industry must be completed.